Peter Yee.
And I'm Monica Agrawal.
We're here today to talk about artificial intelligence in medicine and related topics. If we could maybe transition and talk about how large language models might be applicable in medicine, what are your thoughts on how large language models work in a medical clinical setting?
Yeah, so I think there's kind of different kinds of large language models in the clinical context. So there's a pretty thriving literature that's just clinical specific language models where they've been trained on electronic health record data specifically. And I think I can maybe share something for the comments of, a paper that kind of does a review of all of the different clinical specific large language models that exist. But at the same time, there's been a lot kind of in popular media about these general models, whether it's GPT-4 from OpenAI, or still do quite well on medical tasks. So they've been explored on things like different licensing exams, for example, kind of like study cases from journals.
Hmm.
So then I think there's like an interesting question of, what are they learning from, since we don't necessarily think they've been exposed to electronic health record data.
Yeah. So, so I guess an example that we might automatically think of is like AI being able to pass the USMLE
Mhm.
step exam, which is kind of the major exams that all medical students start to take to get, their certification as a medical doctor. So, is a large language model using the methods that you described to be able to pass an exam like that?
Yeah, so I think there's questions of, what exactly is going on the inside. So one thing that I do want to like make kind of clear is, there's a fear that, these models are learning to regurgitate. So for example, it's possible that some of these step exam questions were found online before, discussed somewhere by students, even in kind of slightly different terms. So it's not necessarily that it's producing novel thought versus kind of pattern matching if it's maybe seen the answer somewhere
Yeah.
online before. But essentially, it can draw from, all of the combinations, symptoms, diagnosis it's seen to sort of answer these sorts of questions. Yeah.
Okay. And so maybe looking at a more clinically specific example of how someone would use a large language model. Let's say someone wanted to give a patient certain instructions. Could they use an LLM to produce that?
So I think there's a definition of could they use that I want to sort of clarify. So I think is it if you were to use a large language model, I think it's certainly can produce plausible looking patient instructions.
Mhm.
And for example, when I studied, what is the data these models are learning from, a lot of it on the internet are things like patient instructions from patient health facing websites.
Mm.
So it's certainly kind of ingesting that data in the training data for these models. In terms of should they be used, all of the kind of regulation around that. There's sort of some trickiness because of the kind of constantly shifting medical knowledge that exists, and the fact that there's no sort of guardrails right now about using large language models in such an open and generative way.
Yeah.
Um,
And so kind of with the future of using LLMs and applying it to clinical medicine and having physicians use something like that, what are some other kind of caveats or warnings that you would want to inform people about?
yeah, so I